Hello everyone. We have a 52-year-old lady who come to you due to intense itching and fatigue. She's not able to specify when her symptoms started as they develop gradually. The past medical history is significant for hypothyroid and carpal tunnel syndrome. Well, current medication include levothyroxine, and in addition to that, there is hepatomegaly is there, no jaundice, but bilateral xanthelasma and skin excoriation are evident. If you look into this, cholesterol level is very high, alkaline phosphatase is high, rest all reports are in the normal range. Right upper quadrant ultrasound shows a normal common bile duct. What is the most appropriate next step in the management of this patient? Well, answer is and check anti-mitochondrial antibodies. Patient has several features of cholestasis, impaired biliary flow, including fatigue, pruritus, and raised alkaline phosphatase. Although jaundice is not that deep, but well, this is the initial stage we are talking about. Right upper quadrant ultrasound distinguish intrahepatic from extrahepatic. Obstruction. In intrahepatic, no biliary tract dilatation, but extrahepatic biliary tract dilatation is there, which can be due to gallstone, and that can be due to cholestasis also. But in our case, there's no dilatation. Okay, so extrahepatic ruled out. It is more of a intrahepatic problem is there. Now, ultrasound says intrahepatic cholestasis. As with this patient, the next step is to obtain serum anti-mitochondrial antibody titers. Why? These are specifically for primary biliary cholangitis. Previously, we were calling it to be primary biliary cirrhosis, but the new name is primary biliary cholangitis, and these antibodies are specific for primary biliary cholangitis. So let us learn about some basic concept about primary biliary cholangitis. It's a chronic liver disease characterized by autoimmune destruction of the intrahepatic. And that's why in this case, when we did ultrasound, the bile ducts were not bile ducts. They were not dilated. Okay, it presents most commonly in middle-aged women. In our case also, she's a middle-aged lady. Incident onset, she doesn't even know when it started. Long history is there. Okay, she even doesn't remember when did this problem started. Well, as the patient disease progresses, jaundice, hepatomegaly, steatorrhea, portal hypertension. Like in this case, hepatomegaly has occurred, although jaundice is not there, but hepatomegaly has really there. That means the disease is progressing. Well, additional thing, hyperlipidemia, like in this case, xanthelasma and cholesterol level is very, very high. Metabolic bone disease can occur, okay, because decreased vitamin D absorption. PBC is often associated with other autoimmune disease, especially autoimmune thyroid disease are often associated with this. And just to inform you, the patient was hypothyroid and she was taking levothyroxine. That is the association with primary biliary cirrhosis. This is xanthelasma. Option B and E. Check anti-smooth muscle antibodies. Prescribe oral steroid. Autoimmune hepatitis is associated with elevated level of anti-nuclear antibody and anti-smooth muscle antibodies. They are characterized by fluctuating hepatocellular injury. This is a very, very important point. Fluctuating. Jaundice occur, goes away. Jaundice occur, goes away. Okay. And there may be elevated transaminase. But cholestasis is not a feature. First-line treatment includes steroids in these cases. Why? Because they are all autoimmune process, especially in this. Discontinued levothyroxine, this can cause intrahepatic cholestasis, number of disease. Okay, but this is not a cause of cholestasis. But now I have a question. Stop the video, write down the answer. Name some important drug which can lead to intrahepatic cholestasis. Stop the video, write down the answer. Well, the answer is macrolide like erythromycin, anabolic steroid, oral contraceptive. Note, levothyroxine is not associated with cholestasis at all. Option D, obtain MRI. This is we use to evaluate abdominal masses or clarify non-specific abnormalities which are not clear on other imaging. It's not needed to evaluation of primary biliary cirrhosis. Golden line to remember, primary biliary cholangitis is a chronic liver disease characterized by intrahepatic cholestasis due to autoimmune destruction of small bile duct. It present in the middle-aged woman and anti-mitochondrial antibodies are classically seen in these cases. In fact, virtually whenever you will be getting a question where they talk about anti-mitochondrial antibodies, then it's a virtually diagnostic. And remember, initial presentation is always pruritus, is the first manifestation. Like this lady also, she came with the intense pruritus. The clinical features are fatigue, pruritus, hepatomegaly, race, ALP. Diagnosis confirmed by anti-mitochondrial antibody titer, as I mentioned in the previous slide. Thank you very much.